always been Dr. Karen Darwin. Um, as far as professionally, I've been a psychologist for about 6 or 7 years. But I was a school psychologist previously, so I've been working in mental health in the psychological field officially since 2004. But I actually started out working with girls and boys in group homes in the Clarksville area back in the late 90s just to see if I enjoy working with that population. So, aside from that, I'm originally from Chattanooga, Tennessee, and born and raised. And Dr. Woods and I met at Austin P when we were both students there. So, I'm getting some feedback. Can you hear that feedback?
I just took it out. Can you hear it
Okay.
now?
Okay. Yeah, I can hear now.
Okay.
But yeah. So just it's been a real faith walk. Sometimes it's hard to believe that I was able to complete my doctorate, and we'll talk more about that today during our conversation, Dr. Woods. But let me know if you want to know anything else about me.
Uh, hey, we're gonna dive all in. th- what is your specialty? What's your niche?
Okay, so I would say that my niche, I work with children and young adults from ages 2 to 22. So I started out my career officially in the schools as a school psychologist back in 2004. And there I worked with preschool age children, elementary, middle, and high school age children. And then along the way, I decided to go back and earn my doctorate degree so that I can have more flexibility and work outside of the schools. So since then, I've expanded my repertoire into working in juvenile justice. I've done play therapy with very young children and teenagers. I do psychological evaluations for young children and adults, young adults. I don't like the food with no grown folks too much unless they come with a they're a parent. They come with a child attached. So, but family therapy, group therapy, all sorts of things. And as most recently, I am a licensed psychologist. So I'm a school psychologist in Tennessee and Texas. I'm also a licensed psychologist in Texas and Colorado. And most recently, I am a registered play therapist. So that just happened, and that took a while, and it felt really great to complete that credential. But yeah, so essentially, ages 2 to 22, young children, teens, adults. My current position, I'm completing psych evals on children ages 2 to 10 for autism specifically. But I'm actually working towards in the very, very near future, hopefully at the beginning of the year, starting my own practice up. So I'm just taking some steps and strides to get that started and get that rolling. So I'm excited about that, and we'll see where that goes.
That's what's up. And with that practice, what would that look like for you? I mean, like, you seem like you're going more and more into a specialty, it becoming more individualized.
Yes. So with my practice upcoming, I'll be starting out very small. It'll just be I'm a sole practitioner. I will be a sole practitioner, and I'll be conducting psych evals for children, young adults, for autism, ADHD, intellectual disabilities, learning disabilities, anxiety, depression. So I do psych evals for all that. And what I also like to do is I like to do interventions and consultation as well. So I would also like to do some play therapy. I have a small caseload of play therapy clients, and just work with them. So both assessment and play therapy. I'm also, well versed and trained in talk therapy, but I prefer like more hands-on approaches, like the play therapy modality versus the talk therapy modality. But since I work with young children so much, a 3-year old, you can't do talk therapy with a 3-year old because they haven't even gained the skills and mindset yet. They're whatever, to have a conversation to tell you, oh, I feel so depressed or I feel so anxious or whatever. So that's my preferred therapeutic modality when working with young children. So yeah.
Right. Well, let me ask you this. We my audience is a encompassed of quite a bit of people that comes from different perspectives of life, different levels of employment. That we discuss a lot as it deals with employment engagement, as we deal with also getting the employee uh, to become more and more empowered. Um, with that said, I want to always put employee kids that we deal with also, the parents that we deal with. I want them to be in a level that they identify as successful for them. Okay, how would you identify success with a parent or a child that you deal with on their level of the treatment and service that you provide?
Well, I mean, in the mental health sphere, success can be, it's really dependent on the client. So, I'll talk about the psychological evaluations first. You know, people seek out a psychological evaluation because they are experiencing some sort of distress and they're looking for answers to the reason why they're experiencing that distress. So either, you know, they're not functioning, if it's a child, they're not functioning in daycare or school, or they're not meeting developmental milestones appropriately. They're lacking social skills or communication, or they may be having some aggressive behaviors. For children and young adults who are a bit older, we look at it, you know, as a adverse impact on life. So, say for instance, an elementary, middle school, high school, or college age young adult, if that person is struggling with building satisfactory relationships, or they're not getting their daily living skills taken care of. So, say for instance, they're supposed to be going to school, they're not functioning appropriately in school, or they're not doing what they need to do on the job or whatever. So, success in that sphere, when conducting those psychological evaluations, would be collecting the data to kind of figure out what the referral question is and then answering that questions. So, say for instance, when a client comes into me for an evaluation, I'm going to do a clinical interview and ask them tons of background information. And I actually premise my interviews like that. Like, listen, I'm going to ask you a ton of personal background information and get all in your business, you know, because people feel uncomfortable going to the doctor and be like, why are you asking me that? You know what I mean? So I try to lighten the mood a little bit, you know, I'm going to get all up in your business. But, you know, it's between me and you. And this is, you know, so that I can make an informed decision to help you and assist you. So it starts out with a clinical interview, and then I go forward, and based on that, what they tell me in that interview, we decide, you know, what evaluations we're going to do. Are we going to do, you know, we're going to look at anxiety or depression or whatever, autism, ADHD, based on those characteristics that they told me about, or based on the characteristics that the parent told me that their child is experiencing. And then we move forward from there. And I perform the different tests, which includes like a variety of different surveys. And a lot of times I do an IQ or cognitive assessment to look at their ability level, look at their individual achievement level, like in reading and writing and math, and just different psychological assessments for anxiety, um, specific autism assessments, just all kinds of things. And then after that, I compile all that data, put it in a report that's usually somewhere between 10 and 15 pages, and hopefully we'll be able to come to a conclusion about a diagnosis. So, and then based on that data, going forward, if a person wants to seek out treatment, because in all my evaluations, I have like recommendations for treatment, things that the person can do to try to remedy whatever the problem is or whatnot. So, whether the person will probably, you know, go to someone else for their treatment, a therapist most of the time. Sometimes they go to a psychologist as well, just depending on, I tell families and clients to, if you have health insurance, use your health insurance as a reference first to find a practitioner because you want to get it paid for if you can, covered it to the greatest extent possible. But based on that data, then a treatment plan is created. And that's the plan to kind of dictate what the services will look like and the timeline for those services. So that's kind of how it goes.
Did I hear you say something about maybe I wasn't about independent living?
Yes, like adaptive behavior. That's a part of it too. Independent living skills, especially with teens and young adults. That's
Okay.
very important. Like some of the young adults that I've tested, because I go up to age 22. Some of those young people, they're in college or they're stuck in life and they're trying to figure out their next move, but they're not moving forward. They're not being successful, and they've gotten down on themselves about that. So yes, independent living skills or adaptive behavior is very important. So I also do those types of evaluations as well.
Okay, let me ask you this. Do you have a personal philosophy uh, that shapes your outlook in life on how you move on a daily basis, knowing that, some days can be a little bit more trying than others?
Absolutely. So, um, my whole premise in life is hope and resilience. And
Okay.
people throw that word around a lot, hope. A couple years ago, I heard an acronym for hope, which was holding on to positive energy. Because in the world, we're constantly hit with so much negativity and, things happen in life. And, now with the advent of social media, you know, people are constantly comparing themselves to other people and that type of situation. Now, mind you, I don't poo poo social media because it can be very positive and a way to connect, but it can also be very negative and tear people down as well. But that hope philosophy. So I heard that acronym. And then for me, hope is an acronym is helping other people excel, enjoy, and achieve in life. I feel like if you can figure out how to do those things, excel, what goals do you have in your life? Like what is your life mission? What would you like to accomplish? Because a person who is goal oriented is usually happy. They're working towards something. Um, excel, um, enjoy. It's also important to enjoy life and enjoy the journey because sometimes people get so caught up on the mission, they forget to enjoy the ride and
Hmm.
they postpone their happiness to a later date. In some jobs, I've heard this. As a supervisor, oh yeah, I can't wait to retire, or I can't wait to this, or I can't wait to graduate, or what if you never get there? Life isn't guaranteed. We're not guaranteed to see tomorrow. So you have to enjoy the journey. Um, so I said excel, um, enjoy, and what was the other one? I forgot already. But
What you brought out because I was one of those people that always try to rush the day off. Always
yeah,
try to rush. And about 5 years ago, I had to teach myself to enjoy the moment,
yes,
enjoy the moment, and I think that was one of the biggest mental health things for me because I've been ready to work and ready to leave work, ready to,
yes,
if I went on the trip, I'm ready to get to the trip and ready to get back home.
yes,
And one day I just woke up and be like, you're not enjoying the moment, and that was a big revelation to me. And I
yes.
see when you were talking about that, I'm like, she's talking about me on the Smith side. But that was things that I had to learn to do. You know what I'm
Because
saying?
in reality, right now is all we have. You can't go back to the past. The past is gone. The past, that's why it's called the past, because it is past already. Tomorrow is not promised or guaranteed. So you have to, right now is all we have. So, yes, excel, enjoy, and achieve, and be goal directed and driven, but taking enough time out to really cherish those moments. Yes.
Well, let me
So,
ask you this: in dealing in this environment of the behavioral health, there's, I'm sure you done ran into numerous employees uh, that probably done got burned out, frustrated, or just didn't know how to deal with a specific patient. What advice would you give someone in that field in order for them to be successful in working with this population?
Dr. Woods, is just like, when you take a flight. What do the flight attendants tell you? You have to put your oxygen mask on first before you put the mask on the person that you're with, if you're with a child or somebody who's less developed. So, with that being said, it's essential for individuals in the mental health field, whether you're a psychologist like me, or you're like a day staff working in a center or a facility with children, because it can be very stressful dealing with human beings, and then dealing with individuals who have diagnoses or potential diagnoses. It's important to be aware, be self-aware and conscious of your behaviors, and being mindful. That's a term that's really popular these days. Being mindful and understanding your own feelings, thoughts, and emotions, and also, not being afraid to express those feelings, thoughts, and emotions with someone you trust. And what I say with when I talk about therapy and seeking out mental health treatment, I eat my own cooking. So, as a mental health clinician, sometimes you have to go to therapy too. So, you have to
Okay.
go and process and talk through those issues. Of course, if you have trusted friends to rely on, that's great. Trusted friends or family members or mentors, that's always excellent. Actually, the best way to avoid ethical dilemmas is peer-to-peer consultation. Talking to a peer about the problem and figuring out what's going on, and helping that person, allowing that person to guide you. But sometimes, when life starts lifing, you need to
Yeah.
go get some mental health treatment yourself. So I have done that myself on a couple occasions during difficult times in my life. And along this journey, it's not easy, as becoming a doctor of anything. And so life is life a lot. So I definitely eat my own cooking for sure.
Well, let me. With that said, someone asked me to ask you, how do you suggest that a professional protect their mental health in a busy society and balancing work and family?
Hmm. Sometimes you're going to be off balance. It can be, it's working in mental health is nothing like you
Yeah.
see on TV. It's not sitting on the couch having a little friendly conversation. Um, that's the glamorized version. Like, to get to that point, I mean, like, either you're working for someone else at a job, or you're out recruiting clients yourself. So that's the business side of it. And then the actual session, there's a concept called transference in mental health. So sometimes, when working with a client, sometimes that person is a little bit too similar, or there's something about that person, that client, that sets you off. So when I talk about being mindful, you have to be mindful about that, so that you don't violate those professional boundaries. That's how a lot of times, you hear about those naughty clinicians who get in trouble for sleeping with their clients, or
Oh Lord
um
Jesus.
yes, that happens a
I
lot. I heard a story
mean, the
recently.
sad part about it, I know about it, and
Yes.
that, I mean, that goes with in any type of industry where somebody is watching over a patient or an inmate or a juvenile, you say it, or a juvenile in a residential or lockdown facility. It, I don't know how these boundaries get crossed, but they do.
And it doesn't happen all in one day. It's a slippery
No,
slope. It's a slippery slope. So one little boundary violation happens, and a lot of times, a client who's been through trauma, they're just doing what they do. That's their survival modality or
yeah,
whatnot. But it's our responsibility as the professional to be able to be like, hold up, this is getting out of hand, or I'm experiencing some transference here, or
Correct.
counter transference is when, the transference is when the client, reacts to the clinician in a certain type of way to try to, relate in an unprofessional way. And then counter transference can happen too when the professional kind of violates those boundaries and starts doing some inappropriate things. So it's very important to be mindful. It's very important to, have those colleagues that you trust to have that peer-to-peer consultation with. And it's important to recognize yourself and seek help if you need it. And, fortunately, mental health is more accessible to a lot of folks these days. And a lot of jobs have something called a employee assistance program.
Yeah.
So the mental health clinicians can be accessed through that, and it's confidential and separate, so they won't go back and report that to your job if you're having some issues. So
Most
definitely,
jobs almost encourage you to use the EA program.
yes, yes, I've used it
That
before.
way,
Very helpful.
I think they feel like if we can get them involved now, we can prevent them from using all these mental health days up. You know,
I still need a mental health day sometime, boy.
in the environment you do. I think whoever sent that, if you have any more questions, concerns, please send it. Let me ask you this. In this environment that we work in, which varies, is dealing with co-workers and dealing with the patients, dealing with the families. Um, I always like to use a funny story, but I'm gonna give one in a minute. Do you have like an icebreaker, a funny story that you can that you share with your clients and their family to them to warm up to you a little bit quicker?
I really don't share a funny story per se because with mental health clinicians, that's part of the boundary thing. Like, we're not supposed to talk a lot about ourselves. You know what I mean? Like, it's
Okay.
about the client. So we're not supposed to disclose a lot of personal information. But I do try to make the session as lighthearted as possible. Of course, very serious. But like I mentioned earlier, when my current position, or when I do the clinical interviews, I let the client know, yeah, I'm gonna get all up in your business. I'm gonna ask you all kind of personal questions and different types of things. And there's no reason, basically letting them know that there's no reason to be embarrassed because this is to help them out. But yeah, I try to steer away from sharing a lot of personal information because that too is a slippery slope.
Well, and you are right. I know for me, being dealing with youth for so long, sometimes I had to say something for them to break that barrier because you know they automatically see this big old man and they keep their distance. But I wanted them to buy in and get comfortable. I want them to talk so that I can see what's going on in their head. You know what I'm
Yeah.
saying? I don't proclaim to be their therapist or anything like that, but I had to get close enough because you know I want them to open up, talk about things, and anybody that knows anything about juvenile detention centers and stuff like that, those could be some lonely moments for
Yeah.
those kids. And
Yes.
you know, then you're dealing with the suicide ideations and all those type things. So when I would have groups and stuff with them in the past, I will just come up with random stories and ask them, like, you know, tell me one thing about yourself that don't nobody know, not nothing too personal, but more of a
Yeah.
funny note.
Yeah.
And you know, of course, you know they try to be all hard and everything, and show their bravado, and I tell everybody this one story. And I was once a gymnast for a little while, and, and
I bet they crack up off of that. Be like, you don't look like no gymnast.
but let me tell you how I got in this situation. At Austin P, it was time for me to graduate, and I just needed an additional. I was taking. I need 24 credit hours to graduate. All right. So I had to get a waiver to get it done and all that, which I done. And so I was like, you know what? with all these classes, where I done took all these science and chemistry and physics classes for so long, I said, you know what, I'm gonna find me something simple. I
Right.
just need 3 more credit hours. I need to find that 3 more credit hours. So I called myself, going to sign. I said, you know what? I see this class, Gym 101. So I said, so I said, I'm gonna sign up for Gym 101. I said, shoot, we're gonna shoot basketball, badminton, volleyball, all the basics and stuff. And you laughed a little too hard. So, as I go on into the class, I'm in a class with nothing but cheerleaders and the guy cheerleaders that used to play football, and now they
Hmm.
cheerlead. And I'm like, something ain't right.
Hmm.
So I think when Dr. Hope came in and said, "Hey, welcome to Gymnastics 101." I'm like, gymnastics?
That balancing beam over in the corner. You better get ready. You better stretch.
All of it. All I mean, all of it, from the balancing beam to doing flips and cartwheels and the pole vault and all that type stuff. So, of
Mm.
course, I done none of that correctly. I looked a wretched mess, but I thank God that there was no cameras on phones like it is now,
Right,
because that
right.
it would still be out there in World Star somewhere, and somebody be wearing me out. Cause I, I had to do this floor exercise. We had to do floor exercises too. So I had to do this floor exercise in my final grade. And in my head, it looked one way. But on the actual day, it looked horrible. I tried to do a running flip, and ain't never done a flip, but I was gonna do it this day. And it got
Oh
so bad.
God.
Dr. Host said, "You up before you kill yourself. Just get up."
So for me, Dr. Chop, it's more of like a way of being because I've worked in several facilities with juvenile and juvenile justice. Actually, that's what brought me to Texas. My pre-doctoral internship was at a
Okay.
juvenile justice center for some of the most severe kids in the entire state of Texas. But it's a way of being. So as we talk here today, we're having a very professional dialogue and conversation because we are very professional. We're doctors, right? Doctors. But sometimes you gotta let your clients know I'm from the hood. Like I'm not gonna, you know, talk in a certain vernacular, whatever, but you gotta let them know you know what's up. And the last facility where I worked, it was the most severe juvenile detention center in Harris County, in Houston. And that's kind of how I operated, like because I am from the hood, but you don't have to put on a persona or change who you are. It's just the ability to relate. I call it being a social chameleon. Like you can
Mm-hmm.
take me to the boardroom, you can take me to the hood, and I can still relate to either way. You know what I mean? So just being
Correct.
able to understand and listen more than you talk, like really absorb people's stories, understand their perspectives. So I do that, with my older teens and young adults, but I also do it with the kids. What are you interested in? Like some of this stuff, I don't know what they talking about. They talk about
Right.
Minecraft and Roblox and whatever it is, and Miss Rachel or whatever. I'm like, okay, I listen to them. Okay, that's what it is. And I just listen to them and absorb and really seem genuinely interested in what they have to say. So for me, it's not necessarily a story or a scenario; it's a way of being.
Yeah, they appreciate you being genuine,
Yeah.
and I think they thought my little genuineness was a little square, because we get talking about music and all that type stuff, and I be listening to the stuff. I try to get there with them and listen to some of the stuff that they be listening to, and I be like, man, this sound like something. Just sound like they mumbling,
Oh,
but
that
they
mumble rap.
understood.
Yeah.
Yeah, they mumble rap. And then I would tell them, I said, man, shoot, give me some Uncle Luke, Two Line Crew, give me. I said, give me some Short Dog. I take a little Snoop. You know what I'm saying? Give me some stuff. They're like, okay, we know about Snoop.
Right.
Who is Uncle Luke? You don't know Uncle Luke?
I
Oh,
sometimes
okay.
I even use that as an icebreaker. I'm old, so back in my day, But then you have to let them know I know something about this era too. Now hold up, now. Be like,
Yeah, yeah.
you know that,
Now
Miss? You know that? Be like, yeah.
let me ask you this: what do you find that has been one or two of your best compliments that a patient or a parent or even a coworker has ever given you?
So this is a question that I've recently started implementing with my psych evals, and I think I'm gonna keep it because it's not really just to stroke my ego or to make me feel good, but after I've collected all the data for the psych eval, write up the report, I have a review meeting to go over the results of the assessment. And with parents, I ask them, did I capture a good depiction of your child?
Mhm.
And I think so far 100% of them have said, yes, you hit it the nail on the head. This is how they are. I said, that's excellent because this psychological evaluation is a tool for you moving forward to explain so you don't have to, verbally discuss everything that's going on. So this is a snapshot. And that's what psychological evaluations are essentially. They're a snapshot of the person's current functioning. So I've asked that over the past several months, and that makes me feel good because it makes me feel like I did a good job, I was receptive, I did the right things, and I was attentive to what was going on in the session. So that really made me feel good. Um, and then years ago, before I even got any sort of license, when I was working in like my first little mental health job, working in a girls' home in Clarksville, I'm like, oh Lord, not that much older than the kids.
Yeah,
I remember,
we all started in Clarksville.
right, not that much older than the kids. Some of them 16, 15, 16, 17, and I'm 21. So
Right.
this one little girl, she was like, Miss Darwin, you always the same. Meaning that I was consistent. You know what I mean? Like some people, some workers who come in, they bring their home life into the job and they take it out on the kids. And, these kids a lot of times have experienced trauma and all sorts of stuff. They don't need you bringing in your garbage and dumping it on them and having an attitude with them just because you having a bad day, a bad week or bad month or year at home. And she said that, and that really, this was years ago. This was like 30 years ago, but that always stuck with me. I'm like, I always want to be consistent with my clients. And that goes back to those boundaries too. Like you got to separate what you got going. Of course, we're human, and that human side of me helps me be a better mental health clinician because I integrate my personality into my work, but I try to leave the drama and the negativity out and just really focus on that client and see them for who they are during that time that we're working together. So,
Absolutely. And in that situation that you're speaking about, that's where an organizational leader, a supervisor, somebody should have came in. And we talked about this last week with Antonio Braxton when we was live. The importance of understanding different perspectives in this environment. You got to be able to get with your employees because you don't never know what they're dealing with on a daily
yeah.
basis. And you are right. Depending on what's going on with our kids, our patients, or whatever at that moment in time, somebody can come in and set your whole day off. And because it can throw them kids or them patients that's already in a situation, they're already borderline. And now that negativity just add to it. Now your whole night is shot. So you got
Yep.
a whole night to calm everything down, get everybody in perspective. And now you have lost all the momentum that you have been gaining with a specific patient or with a group. And now you sitting there looking at them like I kind of wish you would have stayed home today. You know what I'm saying? but, but people don't understand that your uh, effect cause an effect on other people. You know what I'm
Absolutely.
saying? So it's a good thing. Um, which put me in the situation of work-life balance, which I think is very important, which somebody just identified here. Um, what advice would you give someone as opportunity to find their level of work-life balance? What tips can you
I'm not sure if I've ever really truly been balanced, but balance is relative depending on the person. I'm a type of person, I'm goal directed and driven, and I like to stay busy. And I go hard. I go hard, chop. I go hard in the paint. So when I work, I'm working hard. But when I play, I'm playing hard. You see what I'm saying?
offer? Okay.
So my balance may look different than another person's balance. Another
Exactly.
person's balance may be, oh, yes, I work from 9 to 5 every day and I close my laptop at this time and I don't do any work at home. Huh, that's a joke for me. I wouldn't be able to survive
Right.
like that. But I build in pockets of time even when I go, even if it's a work related trip, even when I go to like conferences and stuff, I make sure to figure out some kind of way to throw some fun up in that thing. You know what I mean? So
Always.
I like
Always.
to build in pockets of fun and opportunity. And, one of my life goals is to visit all 50 states, right? So that's
Okay.
travel is my thing. I love to travel. I know it's an expensive self-help tip, but I love to travel. I love culture. I love adventure. I even love, the different architecture, how buildings look differently in different places and the trees and everything. But
Right.
so every once in a while, usually once a quarter or once every, 4 months or so, I try to schedule a little getaway. It didn't have to be an elaborate 10-day, exquisite thing, but just a little getaway. So on my journey to visit all 50 states, I recently checked out state number 29. That excites me. You know what I mean? Like, because that gives me, even when like I'm traveling for work, I always meet somebody random and I'm like, okay, so I got these lame states left there. Well, I shouldn't say lame states because we're online, but I got these
Well,
less
well,
tourist
just
type
don't
states.
identify what you call the lane state, though. They're gonna be
Right.
looking for you when you get there.
Right. Be like, hold up now. But it's funny. Like I was in Austin for work a couple months ago and just having dinner and just struck up a conversation at the bar with a lady. And guess what her name was? Hannah Montana. No, her name was Hannah and she was from Montana. So so she was like, yeah, if you ever come to Montana, you friend me on Instagram. You need to come to Bozeman. And she was telling me about Montana and stuff like that. So that's my self-care. So it may not be every day. I may not be balanced every day, but when I do engage in self-care, I do my thing. You know what I mean? So I would advise anyone to figure out what their self care is. Like some people like getting their hair done and nails done every week. Some people like going to the spa. And you need to make sure it's a balanced approach to your self care too, because you don't want to go broke shopping sprees and stuff like that. Trying to you figure out something that's reasonable, that's not overly priced, or that fits within your budget or whatnot or whatever. But yeah, so that self care thing and balance thing, it varies between people.
I had one of my homeboys, good friend, we grew up together. He was expressing. He said, "Man," he said, "I've watched you for years, and you just seem like you just got everything together. It's like you got this pattern, this pattern." And I said, I do because that works for me. You know what I'm
Yes.
saying? I have to, for me, there is some things I'm not going to do. There's some things I am going to do. There's some things I'm going to cut off at a certain time. There's some things that is not my issue, so I can't let that bother me. And I tell people a lot of times, what I find that goes on is people don't know how to separate.
Yeah.
And for me, I'm gonna separate. And it's just something that I learned from watching a lot of men growing up is that hey, you stick to a pattern. Uh, Especially my grandfather. My grandfather had a set pattern. And I watched him from the time he got up to work, from the time he got home from work. He gonna go work on some cars. He gonna do it. But all that type of stuff, a lot of times people don't know as it, that pattern for me, a set pattern, and the way things go, it's good for my mental health. You know what I'm
Yes.
saying? A lot of people always tell me that I appear to be mean and all that type of stuff. It's not that I'm mean. I'm just not. I'm direct. I'm a person that's very direct. I don't sugarcoat anything. I don't like stuff to be sugarcoated for me. Tell me what it is and let me deal with it. I'm that person. You know what I'm saying?
Yes.
But I understand other people can't handle that. But that's my balance. That's how I get my balance in. And I love my peace. I love my tranquility. I love my quiet.
Yes.
And I think that's a lot of things that people don't have or don't know how to separate. And we talked about that last week. Is one you gotta get to the point where you just know how to say no.
Yeah.
A complete sentence. Just say no. I mean, everything can't be your issue.
Right.
Everything can be an issue. You got to separate. You got to find you some vacation time. You got to find you some me time. Well, and me
Yes.
time and vacation time is two different times. Sometimes a me time can be you going to your little corner and reading a book with the lights on or lights off, and or using the window, the light from the window as a peace of mind. If that's an hour or two, if that's that might happen on the weekend, but you just got to find that time for yourself in order for people to find their work life balance. And I find that to be very important for people to find and
And
to have.
it's interesting you talk about patterns. That's really related to having routines and a schedule in your life, and that's so critical for children too. They really thrive better off of routines and schedules. And when I think about my life, it is pretty routine and scheduled and ritualized during the week, but so I usually wake up at a certain time and I like to have breakfast and I like to do things a certain way. Even when I do my write up my reports, I do it in a certain sequence to keep it consistent. You know what I mean? So yes, routines and patterns are essential, but absolutely figuring out what your self-care modality is and what you need to find that peace of mind. And I don't like a lot of chaos and drama because
No man.
every day I'm absorbing people's issues and worries and drama and mental health. I don't need that in my life. I need to be able to chill and relax and not have a lot of drama to deal with. So reducing the clutter in your life, that's very
You ever watch
important.
the Green Mile?
Yeah, I watched it. Yeah, I remember years ago. Yeah.
In how you were talking about you take in so much, and he would take in people's sickness, but he had to exhale that in the movie,
Yeah.
and that's what goes on. If we can take so much, but we don't exhale it, we're gonna become sick.
Right.
We're gonna become ill. We're gonna be dealing with more issues, and this is not no opinion. These are facts. This is the
Yes.
stuff that causes people stress and strain, and when they start looking at their job different because they do not know how to let go, the compartmentalize, separate, and all that type of stuff. It's very important.
Yes. Absolutely. Yes,
Well,
I've had a little placard. I think I got it like the dollar store, like my first year as a school psychologist. So I've had this thing 20 years. I can't believe it's still holding up, but it has the serenity prayer on it. And every office where I've worked, I have that little placard. Like right now, it's in my home office, but I've carried that thing around with me for 20 years because just a reminder, you can't control everything. You can only control the things that you can, and you have to be able to accept it and move on.
exactly. Well, that's all I have for you, Dr. Karen. Would you like to leave us with one great idea or something that you want everyone to know about you to remember you by? Whether you want to give out your page address or anything.
Look, I haven't even I need to do better about that on social media and stuff. But I've been so busy, I haven't even been on it. I was doing some posts on TikTok, and it's spelled differently. It's DOKTACAYREN. I wanted to mix it up a little bit on TikTok, but I mean, I really don't really check social media a lot. My Facebook is, if you search my name, Karen Darwin, you should be able to find me. And my Instagram is DKaren3. So it's pretty simple there. But I mean, closing comments is, at the end of the day, like we were talking about earlier, don't postpone your happiness. All we have is today. If you
Right.
need mental health assistance and supports, don't be afraid to seek it out. It's becoming, so much more acceptable these days. But it's just like if you had, symptoms of ulcers or heart disease or whatever illness, you would seek medical care. And it's the same for mental health. We all have one body, and it includes our mind and our mentality and stuff like that. So take care of yourself. If you need that level of assistance, don't be afraid to seek it out. It is so important. And back to the hope thing, it's just so important just to have hope and be positive, because we're living in some really weird and crazy times. It seems like the clock is reversed on a lot of things, 50 years or more. But just stay positive and have hope, and don't get sucked into a bunch of negativity. Try to avoid that as much as possible. Take care of your mental space. So that's all I have.
Absolutely. Well, I thank you for your time. Thank you, audience, for your attention. Remember, small victories leads to greater success. I am Dr. Woods, and you have just been hit by the raw approach. Peace.